we know that a child who has poor language skills at age 5 is 6 times more likely to be behind in English at age 11, but 11 times more likely to be behind in maths at age 11. But it also affects their mental health. So 45% of children referred to children and young people's mental health services have a speech and language challenge as well. And that makes sense because we need language to help us understand our emotions. You know, we need to be able to say to ourselves, I'm sad, or I'm happy, or I'm scared. We need language to do self-talk, to think to ourselves, actually, don't worry about that, or, I'll think about that later, or whatever it is. And also we need language to engage in talking therapies if that's what the NHS offers us. We also know that about 2/3 of young offenders have a speech and language problem, but that often isn't identified until they're in trouble with the criminal justice system. And we know that children are far more, when they become young adults, they're far more likely to end up in unemployment. What we really need is to see more of a joined up strategy to give parents information about how to boost children's development. Parents just don't get that information at the moment. If you think about the information that parents get on things like vaccines or healthy eating, that is huge compared to what they get on speech and language development. At the moment, we really have, I don't know whether to call it haphazard or call it a hodgepodge, but you've just got a mess of different initiatives. What we need is a really strategic approach, because 1 in 5 children now have a speech and language challenge. That is a huge social problem, and you can't deal with the social problem at that scale with this haphazard, unjoined up approach. So one thing we'd really like to see is a national strategy. It says, here are the people who really need this information. How are we going to get it to them?